Obesity is the #1 driver of chronic disease. 50% of our adult population are obese or overweight. It drives about 50% of healthcare costs in this country. Diabetes, cardiac diseases, we are going to see a decline because of this historic agreement. We're going to see a decline in costs, but also, more importantly, in the afflictions themselves. President Trump is the friend of the forgotten American. Obesity is a disease of poverty, overwhelmingly. And these drugs have only been available for people who have wealth. At one point, the majority of prescriptions, the highest concentration of prescriptions in this country, was the Upper West Side of Manhattan. And what about the people who live in rural areas, who live in food deserts? What about the people in urban areas who live in food deserts and are suffering from obesity and are locked into that system where they can only get ultra-processed foods, which are aggravating the problem? This will be a lifesaver to them. It's not a panacea. It's not a silver bullet. President Trump has also instructed us to address and end the root causes of chronic disease, and we're doing that. We're about to release dietary guidelines that are going to change the food culture in this country. They're going to change the kind of food the military gets. They're going to change the kind of food that our children get. We're releasing those in December. The Presidential Council for Physical Fitness is going to get more Americans into, particularly our children, into physical activity so that we can attack the root causes of this. But in the meantime, there's nothing more important than we can do than lower this price. As I said, it is the #1 cost of all drugs. This is the biggest drug in our country. That's why this is the most important of all the MFN announcements we've made. This is going to have the biggest impact on the American people. All Americans, even those who are not on Medicaid and Medicare, are going to be able to get the same price for their drugs, for their GLP drugs.